But if you don't get the diagnosis early, then even a 28-day battery of antibiotics is not going to resolve this, from the best of my research anyways. And again, I will yield that it's contested. There are those that disagree with my viewpoint on that in the medical community, but from everything I've read, this is part of the reason why we're dealing with chronic Lyme and tick-borne diseases. Now, the other piece of this that's encouraging, before I get to the guidelines, is the fact that we have research right now in the Hudson River Valley. Dr. Horowitz has written a book called Why Can't I Get Better, that actually picks up on some of the research that Dr. Osfeld was talking about, which is the co-infections. And Dr. Horowitz spends a significant amount of time expanding on this topic and laying into great detail with verifiable results how the co-infections is a major reason why we have issues getting people well again. Because you may be treated, and of course the symptoms are different. The Lyme disease has a certain set of symptoms, and the Babesia evidence is more like malaria. So there's some issues just in terms of diagnosis, and then in terms of treatment, you may get treated for one of the co-infections, but not for the others, and so the disease is you're still suffering. So why I think Dr. Horowitz's research is important is, quite candidly, it allows for some of the medical community that have been, not acknowledging the existence of the chronic Lyme. That gives them an opportunity to potentially save face, right? Because they can say, well, we said it wasn't Lyme. See, to me, it doesn't matter. I just want to get the medical community back together again. So however we can do that, and we can get everybody focused on prevention and diagnosis and treatment, the better that we'll all be. And then let me talk a little bit more about what I think is so important, because it gets to the bill that we're going to be bringing in here in the very near future, has bipartisan, bicameral support. And that is that, in part, the reason why we're struggling, I think, with terms of treatment is because of the guidelines that come out for the Centers for Disease Control, the CDC. And the CDC takes a very narrow definition and gives, in my view, in my estimation, a very narrow set of protocols to follow in the event that you meet any of these indicators for tick-borne diseases. So this is where you get the initial battery of antibiotics and then the 28-day battery of antibiotics. It's coming from this protocol. And the protocol is what we use to educate doctors, and it's what the healthcare insurance companies use to decide what they're going to cover. So now you have a situation all throughout the Hudson River Valley and beyond where you have individuals suffering long-term, years, in some cases over a decade, and there isn't healthcare insurance coverage for it. And so the proximate cause, in my view, is these guidelines. Now, by our government's own standards, these guidelines are supposed to be updated every 5 years. The last time these guidelines have been substantively updated, it's been over 7 years now. So I've engaged with the CDC. I've talked to that director there, Dr. Baird, and his response to me is, well, if the research were different, then the guidelines would be different. But here's the problem. They take a process which is meant to be virtuous, and it becomes non-virtuous. Because the process for publication is blind. It's supposed to be anonymous review. But the problem is, who farms it out? So you have some very promising research that shows the existence of co-infections. Dr. Horowitz's book, I can tell you, when he wrote papers, he had a really hard time getting them published as individual papers. Because of this, in my view, there's a jaundice as far as trying to publish these kind of papers. So when I engaged with Dr. Beard, I'm like, look, you should be acknowledging this new research. And the problem is it's suppressed. That research doesn't get published and it's not acknowledged. This brings me to my bill. So what we're doing is, this bill is addressing vector-borne diseases, including tick-borne diseases, with a special emphasis on chronic diseases, i.e. chronic Lyme. And so it requires the NIH to have a plan how to address these maladies. It requires a strategy, a funding strategy to deal with the gaps. And importantly, for chronic Lyme, it creates a working group. Now the working group will have participation from our patient advocates who have not had a seat at the table in deciding what papers get published. And this is a way for us to address the guidelines, is through these working groups, which the Congress will get to appoint. And as the principal author of the bill, we're going to have an influence on who we get to put on that working group. And what we look to do is get the research published that's tying this together, a lot of this environmental research that's being tied together with the voice from our patients through their patient advocates, and also the medical professionals who have been helping. And we think that's going to help change the trajectory, because we'll get more of our papers published that show the path forward, and ultimately I think that will make a difference. And then finally, when I've asked the insurance companies, why aren't you covering this? You know, their response to me is, well, you know, if it was approved care, you know, then we pay for it. That's the challenge that we're having, because anything outside that 28-day protocol is not considered approved care, generally speaking. And that's part of the reason why we're not getting that covered. So this is the strategy we're taking. We're trying to improve the funding streams for better prevention and better testing, and we're trying to change the guidelines, because that's the way we think that we can make a difference on the treatment and then the healthcare insurance company. So thank you for the opportunity to update you right now.
We'd like to take questions now from people in the audience. I just want to mention before we start that I printed up copies of a piece of paper that has the address of two organizations. One is called ILADS, which is a national organization that advocates for recognition of Lyme and chronic Lyme. And the second is the study at New Paltz, SUNY New Paltz, which has done a lot of work on Lyme and published a lot of papers on it. So you all can share these when you leave. I don't know, I think I printed up about 30 of them. So, okay. Questions, please. Yes, sir.
Doctor, you've been in the field for years. What I'd like to know, my wife and I, we do a lot of hiking and trail observations and things. I'd like to know what you personally use for protection against Lyme.
You want to know my secret?
Okay.
No, well, so when I'm doing field work on these mammals and birds and ticks, I can't use repellent at all, because that would repel the very creatures that I'm trying to collect. So this is true of my field assistants, who I pay a decent wage to, because they're putting themselves in harm's way. We can't wear repellent when we go out into the woods. We wear white suits. These are white coveralls. I don't recommend them. You know, we wear them over, you know, shorts and a t-shirt in July or August in the Hudson Valley. It is excruciating. What I recommend is that there are various repellents that have been demonstrated to be effective against ticks. They're not perfect, but they do a decent job. The DEET-based repellents, if you're comfortable using them, they do work when applied to skin or to clothes. And then there are permethrin-based repellents that are actually both repellents and tick killers. And they work not when applied to skin, but only when applied to clothes. One key issue that many people don't realize is that those little nymphs, the culprits, the life stage that is responsible for most cases, those things are hanging out, waiting for you to brush by at or just above the ground level. So we're talking shoe and sock height. And a lot of people spray their pants, they spray their shirts, their hats. That may not do you much good. You need to spray your shoes and your socks. If you do that, that's a good first line of defense, and that has been shown to help.
Thank you.
Yes, sir.
I have friends who have chronic Lyme, and you said Congressman is very laudatory, but if you believe in science-based research, then why is the House constantly cutting NIH funding in all science-based research over the last 6 years?
Well, let me just say this.
You're voting for those cuts.
Well, in some cases I am, in some cases I'm not. I'm trying to strike that balance. I'll tell you that personally, I think as Americans we talk past each other too much. This is an example, you know, where, you know, you'll hear the left talks about the environment, the right talks about the deficit. We're both saying the same thing.
Yeah, but you're not really answering my question.
No, I'm going to answer your question. What I'm saying is that, you know, the left will talk about, you know, the environment, and the right talks about the deficit, but everybody's concerned about the next generation. You know, the left cares about the environment because they don't want to leave the earth in an awful condition. The right cares about the deficit. I would say that my voting record reflects the balance that I think is necessary. We just came through a winter that was.
How do you expect people in Congress to vote more funds for the things you want, like you're talking about today, if you and others are voting to cut the things they want?
No, I think that, look, I've got a record of bringing people together on this, and there isn't any question on that. And these specific funding sources that I'm talking about, I was the author or co-author in getting them increased. So whether that be in the appropriations bill specifically for the NIH, which was almost $9 million, $8.9 million explicitly for the better testing, or whether it's the Farm Bill that opened up a new fund, that was our office that put that in there. And for the DOD, I was a co-author of that. So, you know, and you have to realize too that the budget that we passed at the end of the year, that was largely influenced by the No Labels group that I'm a leader in. So, you know, that was an example where we were able to come together and get a 2-year budget. And that helped restore some of the sequester cuts. I see this, I do this in extensive research, and I just refuse to accept there isn't a place where we can come together. You know, that there are those, just as you feel firmly on the left, there are people that I know that I work for.
I'm an American, why do you say I'm on the left?
Well, no, I'm not saying you are, but I'm saying part of the challenge that I deal with, is people that are very strong in positions on one side or the other, and I think that there's absolute, I don't see a big divide in our country. I'm an American first, too.
Yes, ma'am.
To get back to the tick.
Yeah, thank you. I appreciate that.
We have the mouse, the chipmunk, and the shrew as reservoirs, basically. Do those or any other animal suffer from Lyme disease infections? Dogs and cats do get Lyme, correct? Do we ever see mice complaining about the
Well, I listen very carefully, and but so the answer is that outside of horses, dogs, and if you listen to some veterinarians, cats and humans, no other animals that get infected with Lyme show any signs or symptoms or any shortening of their life at all. And in the case of white-footed mice, we have some intriguing evidence that being infected with the Lyme pathogen makes mice live on average 17% longer. And this observation was sufficient for us to successfully get a fairly modest grant just this past winter from the National Science Foundation, where the funding rates are about 6%. So, you know, 1 out of 20 deserving proposals are funded due to budgetary constraints. We were lucky enough to be one of those few that got funded to actually experimentally ask what impact does infection, or actually we're going to clear the infection using a vaccine, what impact does that have on the behavior of mice in ways that influence their encounter rates with ticks? That's very, very important. Their survival, how susceptible are they to predators, and to what extent do they, whether they're infected or not, impact other species within these forest ecosystems. So we're on top of it as of this year.
Yes, ma'am.
A two-part question to follow up on this. What is the ecological niche of the ticks? I'm wondering what is their role, beneficial role in the environment? And then also, when you were talking about these middle-sized predators, so do they get infected and don't pass it on, or are they actually resistant to the Lyme? I'm not clear on how it is that they are a barrier on spreading the disease.
Right, okay, so two great questions. So the first one is, you asked, it's a two-part question. There's a subtle but critical difference. What's the niche of the tick, and then what's sort of its purpose? And that second question is a teleological one. The niche is that they're a blood-sucking parasite. I mean, they're a scourge, and you know, they're something that we want to do battle with to protect our health. What their role is, as a scientist, I can tell you what role they play, what's their habitat, what's their niche, what's their impact on other species, how they evolved. I mean, there are tons and tons of different kinds of ticks. It's a lifestyle that has evolved repeatedly in various parts of the world within this group of organisms. You could ask the question, well, what would happen to ecosystems if ticks were suddenly, summarily wiped off the face of the earth? And the answer is there are a few species that would disappear because they eat only ticks. None of those things live around here, but in Africa there's a bird called an oxblower. You've seen these in nature specials. They perch on a rhinoceros and they eat all the blood-filled ticks all over the rhinoceros, and that's how they make their living. So they would go away if we got rid of all ticks. There aren't that many things, though, that make their living on ticks, and there aren't that many things that are killed off by ticks, although there are a few. This happens to moose with winter ticks, that they do get killed off by them. So they do play a role. The second question about why these other mammals, other than the little guys, are resistant to infection, we don't know that much about the actual mechanism. Their immune systems function differently. We don't yet know how they function differently. They get exposed all the time. There are infected nymphs that are biting them constantly. And you can take their blood and find antibodies to these tick-borne pathogens in their blood. But they do a good job of clearing the infection so that it's a one-way street. The pathogens come in, but they don't come back out. And so we, unfortunately, we resemble mice. I hate to tell you, in the sense that we don't do a good job at all of clearing an infection on our own.
Yes, ma'am.
Back.
Dr. Osfeld, you discussed the nymphal stage, which of course causes most infection because they're so very tiny, but some of us get bitten by adults. So would you specify the infection rate in the adults? And just one answer to this woman, moose populations are being decimated by ticks. So, you know, with everything there's balance. Thank you.
So with adult ticks, it's true that they have approximately twice the infection prevalence that the nymphs do. They've had 2 opportunities to acquire an infection, unlike nymphs which have had only 1 opportunity. So as you might expect, it is the case that they, on average, instead of about 30% of nymphs being infected with Lyme, about 60 or even higher, 70% of adults are infected. So we do need to worry about adults. They're just much bigger. They're much easier to see and feel when they're crawling on your body. People tend to find them and pull them off, and they tend to be active in November, December of every year, and then again the next April or so when things warm up a little bit, March or April. So there are a few cases of tick-borne disease that are caused by bites from adults, but it's probably less than 10, probably even less than 5% of the cases at the best estimate.
Yes, sir.
I just want to thank you for your leadership in this issue, and we know what you're up against in terms of powerful lobbies against patients and families. Can you tell me who's supporting the bill that's in front of Congress?
Yeah, thank you. So we got a number of co-sponsors right now that are interested in joining on. So Peter Welch from Vermont, Joe Courtney from Connecticut, myself, Frank Wolf from Virginia, Chris Smith from New Jersey, and just as the research from Dr. Osfeld shows that the prevalence in the upper Midwest now is becoming more numerous. So we have 2 new co-sponsors, Colin Peterson, a Democrat from Minnesota, and Ron Pine, a Democrat from Wisconsin. So we feel confident that we've worked this thing very extensively. It's been a series of negotiations now for many weeks, and we're up to the last phase. We think the final piece of it has been worked out, and Leader Cantor has now backed off one of his pieces of it. So I think we're about ready to get it across the floor, or get it introduced and get it through committee and the floor. And on the Senate, so Senator Gillibrand and Senator Blumenthal have been advocates on the Senate side. And again, where I think this is really important is, while it's true we've been pushing for more funding, which we could use, it's also the issue of where it goes. We've had monies that could have been, I think, better used had we gotten into the right places for the research. So if we can get advocates at the table that can influence where the research monies end up going, then I think we can capitalize on some of the wonderful underlying research so that we can get a quicker commercialization for the prevention products, and also ultimately change the guidelines, which I think will not only quicken and make more effective the treatment protocols, but also the health care insurance coverage.
Yes, ma'am.
My doctor suggested prophylactic if you find the tick attached, taking a double dose of doxycycline once. Because he says that there's an exchange of fluids. So I've heard people report totally different protocols by doctors. And I think that's one big problem, is that everybody's on a different page.
I agree. Look, I'll let Doc speak to the science here in a second. From a personal standpoint, that's what, our middle daughter was bit by a tick, and that's the protocol that they use. Now, you know, I don't know that that was agentic, but it doesn't appear that a tick-borne disease has developed. I don't know whether or not that protocol prevented it or thwarted it, or whether or not it wasn't going to develop anyways. I do agree. Part of the challenge for the treatment is that the guidelines are so narrow that we have issues with the efficacy, but we also have issues because we have a lot of experimental work being done, but we don't have a repository of the information. Because doctors are loath to send it in, because if they do, that's tantamount to basically saying they're not following the protocols. You see what I'm saying? I mean, if they actually send in how they've been successfully treating it, it could potentially expose them to lawsuit or even, you know, and I think that's a problem. I mean, that's part of the reason why I think we need to address these guidelines, is because I think it'll get after what you're suggesting there.
And the other great thing is, just along 203, you see masses of debris that people have dumped or have never been burnt that are havens for mice. And because I have done restoration work with burning, I also have suspicions that not burning and allowing all this debris to collect is a perfect haven for mice. And then the predators can't get in there when you see these rose bushes that are just so dense you can't walk through them, filling the woods. So I think there's just that whole level of, on the gardening level and on the landscape level, of good practices that haven't been followed to have a healthy landscape. So part of that, a big part of that is not only information, but gardening practices and landscape companies that could do a big job to make a healthier landscape.
Well, I think you raise an excellent point, and you know, Lyme disease is the sort of great integrator of everything from the environment, climate change, human health, diagnostics, treatment. Human behavior is critically important. And it is known that some of these particularly exotic shrubs, like the rose, the multiflora rose that you mentioned, Japanese barberry is a well-demonstrated culprit, honeysuckle as well. These are exotic species, and they promote high population use. That's been well demonstrated now in several different studies. So it is the case. I don't know about brush or untended, unburned debris like that. That is a good habitat for mice. They do love to get under protection because they're constantly worried about getting nabbed by some predators. So it could well be the case that poor management of debris and invasive exotic shrubs are going to exacerbate the Lyme problem in particular areas. That is plausible from a scientific standpoint.
Yes, ma'am.
I guess, thank you so much. It's been extremely informative. I have a clarification, comment, and so the clarification when you said the Lyme shield.
Can you speak up a little bit?
Sorry, we can't hear you. Is the Lyme shield only to protect against Lyme?
Yes. Yes.
Jim and Ira.
Yes.
Yes, right now.
They're working on other bacteria as well.
Could you, Jim, could you repeat the question that you're answering?
She wanted to know if Lyme Shield only worked on Lyme. The answer is yes. Okay, the same company is working on additional vaccines for other. Once the Lyme Shield is introduced in 15.
You're talking a vaccine. I thought it was a pellet. that was one of my questions.
Yeah, this is a pellet that's ingested by the, we would think that the mouse would want to eat it, and in fact, in the studies, the mouse does eat the pellet, and then it cleanses the body of the Lyme.
How would it be?
It actually vaccinates the Lyme, Congressman. And so it will no longer have active bacteria. Once it gets enough, it has to eat the pellet 3 times, and the food has to be dispersed 3 times.
How does it get distributed, the pellets?
Well, in the limited studies, they had a controlled environment where they could actually proliferate it. Now, as we were talking about, we were sidebarring before we came in. Jill, did you want to amplify on that?
Yeah, well, one of the things that they're looking at is rabies has been rather successfully nailed to a very, very low level through vaccination of our pets, but also through a wildlife bait vaccine that has been airdropped for the reservoirs for rabies. So I think it was in 2012, there was only 1 human case in the United States. So their idea was to follow that in the parklands, was to have that they would drop these pellets in the parklands, and on private property it would be a different story. They haven't totally worked that out, whether it would be spread by hand or whether there would be little boxes for the mice. Of course, it's always a cost thing, and apparently what I saw was that it was very cost effective, at least, you know, spreading it widely. I don't know if they have to go to boxes, but I think they figured reducing Lyme disease would average about $2 per person. Do you remember seeing this, Rick?
Yeah.
And versus if we have to go to be vaccinated for Lyme disease, it's hundreds of dollars. And this reduces it in nature. This is where disease is increasing and spreading. We're a dead end. Vaccinating us doesn't really do anything to reduce the problem. This would.
So that was one of my questions, was whether, because local public health has been very interested in seeing whether Lyme disease vaccine is going to come up again, and so.
This looks very promising. You know, I will tell you that, I mean, where we are in the process now is it's been through trials, and we're looking for final approval for commercialization of the product, which would allow for its proliferation in wider use.
My last question. When I lived in New Jersey and tick bit my dog, we actually.
Can you please speak?
Sure, I'm sorry. When I lived in New Jersey and ticks bit my kids, we were able to take the tick and bring it to a location to be tested. I don't know if there's any value in that. I know they don't do that in New York when I come, at least in this area. I don't know if there's any value in that, or, you know, when you get your response to what drug to give the patient, or is it just a blood test?
Yeah. Well, I can't verify it happens in all 11 counties right now, Steve, but I know that I've talked to some of the county health organizations, and in fact, they will test the tick if it's brought in. Yeah, so I know Squaharity was doing that.
Do they do it in Columbia?
What I will do is I'll take that as a task, coming out of this, Steve Bolger, I'll take this as a task, that we will reach out to our 11 counties and find out where they are in that policy. That's a great point.
Yes, ma'am.
Just to tell you, I had a tick on my body last week. I was in New York City, and they immediately took it and did send it to wherever this was sending the doctor to. But my big question was, you talk about your tests and your research not being able to be published. I'm an old publisher, and under that, I mean, I don't know whether you're going to Science or Nature or why that is true. Why is that versus anybody who has, you know, anything else published?
So,
the reason that nobody wants to publish these works?
So, what I'm conveying here is what people have told me. I'm not writing on this subject personally, but we have experts in the Hudson River Valley that have, and they've tried to get their papers published, and because it's done anonymously, they farm it out for review, and it comes back like this. And that's why I was suggesting in my opening remarks that a process that's supposed to be virtuous. I mean, the whole reason why you do that is to take the politics out of publishing, and in fact, you've injected the politics. At least one argument is that some of the most important research has not made it to publication because there are forces, and there are forces that just don't agree. They don't think, there are people that think that the chronic Lyme is not really existing.
Let me add a little to that as someone whose my bread and butter is publishing. I get, you know, reappointed as in my job or not on the basis of how well I'm publishing, job, salary raises and the like. This is what we scientists exist for, right? So the idea is, you collect your data, you write it up. It takes an enormous amount of time. You prepare a manuscript that you submit to a journal. That manuscript then gets sent out to review, sometimes 2, sometimes 3 different scientists. And that's where the anonymity comes in. Those scientists remain anonymous unless they wish to sign their review. Scientists are, we are trained to be as objective as we can and as skeptical as we can. And of course, we're also human beings at the same time. So that objectivity, that's a holy grail. We are atrociously bad at being objective. We try as we might. And there are some that are honestly trying to be objective. But everyone, scientists are human. You have your pet idea about the way the world works. And if you review a manuscript for a journal that says, no, there's some other way that the world works, you are going to cast a jaundiced eye and use that training. You've been sharpening your teeth ever since college on how to trash some other paper. So if you don't like the message, even if you're trying to be objective in appraising it, your preconceived notions will influence the way you treat it. Politicians are no different. I think the congressman would probably agree. They're trying to appraise the evidence for whether one policy or another is better. But their constitution, their parental, how they were raised, their religion, their, what kind of society they grew up in will influence their ability to be objective. And so what's happening in this case is that there are scientists who just don't believe in chronic Lyme. And they will write very critical reviews of those papers. And if there are enough of that faction, then those papers will not be published in those journals. You can always get it published somewhere, but if it's published in a lower quality journal, it just has no claim.
And why that matters is the Centers for Disease Control is using that as the basis for the guidelines, which is leading to a narrow interpretation, which some would argue leads to a prevalence of Lyme literacy and also treatment protocols that aren't as creative and effective as they could be, and ultimately healthcare insurance coverage that in some view is inadequate.
Rick, can I ask a practical question? If you have a tick on you, either a fully grown tick or a second stage, how do you get it off?
You take tweezers, fine tip tweezers, you grasp it as firmly as you can right next to the skin, so right at the mouth parts, and you pull straight out. So do not put Vaseline on it to try to smother it, or nail polish. Don't take a match and put the burned head of a match on there to try to torture it to get it to leave on its own. They can't leave on their own. They're cemented into your skin. And you're wasting time. The key thing is to get it out as quickly as possible, and that's the most efficient way to do it. You don't want to give the tick more time to transmit the pathogen. Get it out fast.
What if some part of it is left after you pull it out?
Don't worry about it. Have the doctor look at it. It's potential you could get a secondary infection if you have little mouth parts of the tick sitting in your skin. I've had many mouth parts of ticks sitting in my skin. They almost always come out like a splinter, a shallow splinter would on their own. So, have it looked at, but don't be too troubled. Don't start digging around to try to get that stuff out.
Could I say something?
Yeah.
Vets have a little gadget, they call it a Tom tool. It's like a tiny crowbar. It's exactly like a crowbar, but it's only about that big, or the claw on a hammer. And you put it, you get the tick in the claw, and then just twist. You don't pull, you just twist. And any size, any degree of penetration immediately is broken. You even hear a little pop, and everything comes out. Could I follow up that little bit of information with a question? Someone told me that if you kill a tick, which is definitely your motivation, you hate the little thing, and so you try to crush it with a thumbnail, that can actually give you in possible infection under an nail?
It would be highly unlikely. So these pathogens are inside the body of the tick. their route to get into your body is almost exclusively through the bite. It has to pass from the tick's gut into its salivary glands and then into you. Potentially, if you crush it between two thumbnails, which I sometimes do just for revenge, if you do this right close to your face, there is a tiny probability that you would create a little aerosol explosion where some of the pathogens could get into this membrane. The likelihood that that would actually infect you is exceedingly low, but you know, when I do it far from my
If you found that you were out of doors, first of all, what Dr. Osfeld said about dressing right and spraying your clothes with ether, and that stuff really lasts through the TV watch and how it really works. But if you find yourself outside and you've been anywhere risky, you should always, of course, do tick checks and everything else. But what you do, because ticks can't stand how their bodies dried out, they'll die. That's why you have to keep everything in the sunshine, get rid of all the leaf litter, children's things. Walk over to your dryer.